Hello everyone. In this video, we'll discuss how to use glucometer, is it reliable, and why values are different from lab. First, let's understand what are the parts of glucometer kit. In the glucometer kit, we have one lancet device, one glucometer device, and glucometer strips. Steps to check glucose from the glucometer. First of all, sanitize your hands if we are doing it for other patient. Inserting the needle in the lancet. So this is a lancet device. So we have to open it up and there is a slot given for the needle. So we will fix the needle and just twist the cap of the needle. Now the needle is ready and then we will close it, and you can see the marking here, the point here, which is to increase or decrease the depth of needle prick. Putting strips into the glucometer device. So let's understand how the strips are put in the glucometer device. So this is your glucometer device, and this is strip. So this is usually covered in a aluminum pack. So we have to first take the glucometer strip. This glucometer strip has two ends. One will go into the glucometer into a slot, and other where we will put the blood drop. So usually the arrows are given to insert it, and the other end we have to put the drop of the. Now glucometer is ready to use. Before finger prick, ensure everything is ready. Means split swab should be ready, lancet device should be ready, and lancet device should be loaded like this. Now it is ready to use. How to prick the finger? To prick the finger, we have to use only three fingers: index, middle, or ring finger. Now, how to put the blood drop on the strip? So we will first clean the finger with the sprit swab. Now with the help of the lancet device, at the tip of the finger we'll prick it, and a single drop of blood is enough. We'll just touch the strip with the blood. It will automatically take the blood, and after few seconds you can notice the reading of blood glucose will be displayed on the monitor of glucometer. Now the question is, are glucometer readings reliable? This is a very important question asked by many patients. So answer is yes, fairly accurate reading, and they assess the glucose trend. Is there any difference between the lab and the glucometer readings? So lab test is done from the venous blood usually, and glucometer test is done from the finger prick, which is a capillary blood. And this capillary blood is more than the venous blood. Therefore, you see a difference between the lab test and the capillary blood test. Thank you for watching this video, and if you have any queries or any questions, you can put in the comment section.